Have you ever had a bone density scan but had no idea what all those numbers mean? Today I'm going to show you how to interpret your DEXA scan and share some simple natural ways to keep your bones strong for life. Hi everyone, it's Dr. Tidman. Thank you for checking in and visiting my channel. Today is part 5 in my Bones 101 series. I hope that you've enjoyed the series, that you've learned a lot. Drop a comment below if you have questions, or just let me know if this content is helpful. And remember to subscribe so you'll know when my future videos are being posted. Remember, this content is for informational and educational purposes only. So if you want to change something or adjust your medications, consult your own medical team. So in my series, I've summarized a lot about bone metabolism. Bone is a very active endocrine organ. Bones have regulatory functions in balancing your blood sugar. Yes, they help to do that. Higher blood levels of circulating glucose can lead to systemic insulin resistance. We've talked about that a lot on my channel. Insulin resistance can also be present within the bone, affecting osteoblast and osteoclast function. So insulin resistance has effects on every organ system and your bones. We can't ignore the function of hormones in both osteoporosis and insulin resistance. Studies differ on the relationship of insulin resistance, metabolic syndrome, and osteoporosis, but there's lots more research on how these three conditions interact to affect your bone density. Insulin resistance and metabolic syndrome evaluation should be done routinely with osteoporosis screenings, especially in postmenopausal women, and they do not think to look at metabolic health markers. Future studies need to be done on the presence of insulin resistance and how this places patients at risk to develop osteoporosis in the future. So what is a DEXA scan? Remember that a DEXA scan is only part of this picture. It's not the whole story. So if your current treatment plan is developed solely on your DEXA scores, then I hope I'm going to teach you some ways to ask your doctor to check other factors that are just as important in bone density as your DEXA is. So T-scores, what are T-scores? So T-scores are a result of how your bones compare to the bones of someone in their 30s. So yeah, they're not comparing you to people your age when they calculate a T-score. So T-scores 0.0 to negative 0.9 are considered the normal range. And of course, anything above 0.0. Negative 0.1 to negative 2.4 scores indicate osteopenia, or a weakening or less density in your bones. And then any score that is below, it's kind of hard to know these are negative scores, anything that is below negative 2.5. So that's negative 2.8, negative 3.0, and so forth. This is when they classify you as having osteoporosis. So Z-scores, and you'll see these on your report, indicate how do your bones compare with others your age. And I personally think that Z-scores tell us a lot. If we're going to compare me as a 68-year-old female to a 32-year-old female, well, yeah, I would expect my bones would be a bit different. So take a look at your Z scores and see where they fall. Often, your T scores can be low compared to normal 30-year-olds, but your Z scores aren't too bad compared to those your same age. I don't know why T scores were established as the standard. Maybe that will change. One can always hope, right? So what is TBS? I bet you've never heard of it. And I bet your doctor's never heard of it. Trabecular bone scores are now being used as the standard of care. The TBS score scores the quality and strength of your bone matrix. You see how DEXA for density is only part of this picture? DEXA does not tell you anything about the quality of your bones or the strength of your bone matrix. DEXA plus TBS, done at the same time by the same scanner, is really a more complete picture of how your bones are doing. A normal TBS score is above 1350. If your bones are deficient in terms of strength and quality, that score would range from 1200 to 1350. And then if you were significantly impaired in your bone strength and quality, your TBS score would be below 1200. So my recommendation is to ask your doctor to order both. Now, realize that your doctor may have no idea what a TBS is. And so now that you've watched my video, you can educate your doctor on why this score is important. Also, keep in mind, the scanners that do both are a lot more expensive. So healthcare systems are not wanting to buy these more expensive scanners when TBS has not been established as the required protocol. However, in the US, I would say that most cities have a scanner that does both. Now, first, you have to ask your doctor to order both. And next, you have to call the imaging facility and confirm that their scanner does both. Isn't it funny that patients have to do this? I have a patient who lived in a very large US city, 600,000 population. She could not find one scanner in her city that did both. In fact, when she called these facilities, they had no idea what she was talking about. She had to go to the next largest city in her state, where she found one scanner that did both. So she had to travel an hour away to get her DEXA plus TBS score. Seems really odd that we should do this, but one of the things I do on my channel is I empower you to ask for what you need. I am not sure of the presence of TBS with DEXA equipment in other countries. If you know what's available in your country, drop a comment below and let me know, and I can let others know. So thanks for leaving a comment. You can help others with this issue. This is the reference I used for the scores that I presented to you. Thank you for stopping by Bones 101 Part 5. Yeah, it's been a fun series. I hope that you've gotten a lot out of the series. Watch this video again. Go grab your DEXA report. Look at your scores while you're listening to this video. and see what your DEXA is. Drop a comment and let me know if you have questions about your DEXA scores. Remember to subscribe, and also remember that there is a lot you can do to improve your bone density, bone quality, and strength. So check out the other 4 parts in this video series, and I'll see you in the next video.